I'm on?
Yep.
All right. This is Dr. Mohan.
Hi there.
He's going to demonstrate for us today doing an ultrasound guided IV.
All right. All right. So before we start, one, recognizing this is our ultrasound machine here that we're using. What we're basically doing is we're trying to visualize the vein that we're trying to access. So first thing to do, make sure you're able to turn this on. I generally try to keep this plugged in. This way the video doesn't turn off while you're performing the procedure. As you're continuing doing the procedure, you're going to come around here. Okay. So this is a standard Sonosite machine, which is probably seen in most hospitals. As soon as you turn the device on, you'll see 4 different selection modes here. So you want to start off by using that green button, which is a scan. There are different transducers that you're using. Those are those different ultrasound probes. The one that we're going to use is called a linear probe, usually indicated with an L. This specific one has what we call a smaller footprint, so it's just a smaller probe face, and it's called an L25. So if you go back to the screen here, you'll notice there's a portion called transducers and exams. If you click on that, you'll notice that there is a indicator for the linear probe, or the L25. As you scroll down on different sections, there's something for venous that you want to select, and then hit the green button to scan. All right. So as you can see up on the monitor here, you'll see a display. It looks like a flat screen, a couple horizontal lines there. Always good to check if your probe is there, and you can see it's causing a little shadowing there. What I generally do is I try to scale back on our probe here. Over here you'll notice on our y-axis here, so the one that goes up and down, it tells you how deep you're going to see images. I tend to select anywhere between 2 to 3 centimeters, so I'll comfortably put in around maybe 2.4 right now. Okay, so I know a lot of stuff that goes on for the preparation. Doing the actual procedure doesn't take as long. So in addition to that, we're going to have our flush, your angiocath. We're going to use a 20 gauge angiocath today, the J-loop, and the remainder of our equipment, including tourniquet, our Tegaderm, tape.
Just a regular IV start kit.
So, important to keep everything prepared for you. So a couple different ways you can approach this. You can either keep the ultrasound on the same side as which you're going to access the IV. There'll be a lot of head turning back and forth to see where you are on the person's extremity as you're approaching the procedure. Or you can approach it from the opposite side and be able to lift up your head and approach the screen as well. So for this one, I'll keep the screen on the same side. It'll just be easier for me to access my equipment as well, and for you guys to visualize it too. So
When you're first learning how to do it, it's a lot easier to be on the opposite side, like Dr. Mohan just suggested. It's a lot easier to, so that way you're just looking up and then looking down at your, looking up at the screen and looking down, because you're not ever really looking, you're more looking at the screen when you're about to do your ultrasound.
So as you would for a standard IV, you want to make sure you prep the area. And I'll get a good surface area of the arm there. Now, when approaching this, try to make it as clean of a procedure as you can. So I would suggest using sterile lubricant versus the standard ultrasound gel that you have. So this is the standard one that you have. And then you have your sterile lubricating gel as well. So apply a decent amount, a good copious amount of it. Got a couple here. Now, a few different locations you can use. You can search towards the antecubital area. That's where you usually find a brachial vein, especially if there's a deeper one that you can't access. You can search the forearm as well. That's not a most preferred location if you're trying to quickly get access. And then there are the larger veins that are above the antecubital fossa, which are the basilic vein, which runs more medial, and your cephalic one, which runs more lateral in the upper extremity. For today, I'm going to try to just approach one of the peripheral veins right within the forearm, just before the AC. All right. If we're not having success with it, we can always move on to a larger vein. All right. So, something else you'll notice with this ultrasound probe, there's a little notch here which correlates with the sonocyte symbol. All right, the little blue symbol there, as you can see. You can see it kind of shadowing there. So, you want to make sure that it's in the same plane as the video that you're seeing. And you'll kind of understand what I mean by that. All right, so basically that little notch is going to correlate with the left side, and obviously the opposite side is opposite of the notch. All right, so what we see here, we see a lot of soft tissue. All right, so there's some muscle tissue, some adipose tissue, and then you see this big blue, sorry, not big blue, the big black area here, and you notice that it's very compressible. So veins tend to be a lot more compressible than arteries. And here I'll kind of demonstrate to you another location where you can see an artery further down. You'll notice the pulsation of it as well. Now, if you're ever having trouble determining if it's a vein or an artery, you can do something called a color flow. So let's move up to our vein here. You'll notice that over here, you don't see a tremendous amount of flow. Let's see if I can release a little bit more. There we go. All right. Now, traditionally, you should get some flow there. If you're not getting enough, you can always compress it to see if, there you go. See how there's flow through that vein right there? And you notice that it's a steady flow, and it tends to show up red, okay? And red just basically means it's gonna go towards the heart here, okay? Arterial, on the other hand, let's see if we can bring it down here. Let's look at that again. All right, right down there. See? So you'll see more of a pulsatile blue color. That would indicate that that is an artery, which we do not want to access. Okay. So for today, we're going to attempt to access this vein right up here. Now, a lot of patients that appear to be more dehydrated or volume down, a good approach would be to use a tourniquet. Today, I'm not going to demonstrate it with the tourniquet, but it is definitely an approach you can take. Before you put that tourniquet on, it's always important to at least scan, which means using the ultrasound to kind of move up and down the arm to determine, where the vein is that you want to access, and then applying the tourniquet to help dilate that vein a little bit more. Obviously, in this particular situation, it doesn't appear that I would need to use that tourniquet. Okay. Another thing before you're approaching this is make sure that you're scanning or moving that ultrasound up and down the arm, approximately maybe an inch or so, just to see the trajectory of the vein. Is it is it sinking down into the arm? Is it staying in one plane? Because as you're going to notice as we're getting IV access, that we have to carefully approach these veins and make sure we're not poking multiple times and not changing orientation often. So this appears to be quite straight and doesn't bifurcate at all, which is good. So we'll gently leave this right here. So we'll start by lifting up our IV, our angiocap. I'm the physician and I'm not a nurse. I tend to make a huge bloody mess sometimes, but I will say we'll be a little bit more careful today. Thank you. Appreciate that. All right, so there we go. All right, as you can see, the depth of that vein is approximately a half a centimeter to a centimeter down. So what you're going to do is approach this angiocap at a 45-degree angle, roughly 45-degree angle, and approach it approximately about a half to a centimeter away from the ultrasound probe when you're entering the skin. So there we go. Poke. Okay. So a couple things you'll notice is you don't notice a needle point yet, but all right. If you look at the screen, what we see there is the needle tip inside the vein. as I was approaching it, you could see that I was tenting that vessel as I was going in. And as I poke through, you'll notice that it's right in the center of that lumen. What you're going to do is continue with the needle and the angiocap and continue moving up the arm as you're also scanning up the arm. And what I mean by that is I'm going to move this ultrasound up until I lose that point, drop the angle of my angiocap and my needle, and advance. And it reappears. Now you're going to continue doing this until you're about 2/3 of the way in with your angiocap and your needle. Okay, which I'm much more than that. Now, obviously before advancing, making sure you advance that angiocap, apply pressure.
Look at you.
Alright. Secure it on. Good. Alright. Now obviously take the next few steps after this is cleaning off that gel, making sure you secure it with the Tegaderm, alright? Making sure you draw back and flush as well.
Yep.
Alright?
Perfect.
Yeah.
Thank you.